Today we are going to talk about medical tattooing or paramedical tattooing. It is used to treat any type of scar tissues, including stretch marks. So stretch marks is something we all have, which has happened because we grew up and we have gained weight, we have lost weight, we went through a pregnancy, we went and did so many exercises where we stretched more, etc., etc. And the other ways of having scars in our body is, one is any surgical intervention, and it could be an accidental scar. You fell down, you had an accident, something of that sort. Some of us have self-harm scars. All those things, all these can be treated. So treatment of scars using tattoo techniques, it's going to take between 1 and 6 sittings most of the time. Not always 6 sittings. It depends on the width of the scar and the depth of the scar. So the only thing, a catch, is that if it's a keloid scar, and if you know that it's a keloid scar, it has been diagnosed by a medical professional that it's a keloid scar, then we cannot do it, because keloid scar, once it happens, that scar area tends to go back to keloiding always. So that's kind of like, so we have to, if we suspect that it's a keloid scar, we might send you in with the GP or your doctor for further investigation to figure out whether it's keloid or not before we start the treatment. And with the treatment, the first type of treatment we do is, or the first set of treatments we do, is inkless tattooing. So we use a regenerative serum to do the inkless tattooing, and sometimes a brightening serum depending on the bird. The first sitting is always inkless serum, which is a regenerative serum, and we make break in the scar tissue. And so doing the tattoo with the serum, we deposit the serum into your scar tissue. So because the breaks are made, it heals up again. And when it heals up again, a better layer of collagen is formed underneath, and the scar tissue slowly degenerates. So it takes 4 to 6 weeks for the healing. And so obviously the treatment will be every 4 weeks, every 6 weeks, depending on how your body heals. If the scar tissue, when we touch, it is the same skin level, it feels the same, and so the scarring is gone, but say that there is a bit of discoloration left, that's where the camouflage tattoo session comes in, and that's where we see your skin color, we match the pigments to your skin color, and we go over the tattooed area so that it is totally camouflaged and it looks normal, it feels normal, and you will not find the scar anymore. That is basically medical tattooing.